Have you ever felt disconnected from your body or your surroundings, as if you're observing your life from an outside perspective? If you've ever experienced this, you might have encountered what psychologists call depersonalization, or these are complex terms for a fascinating yet somewhat unsettling phenomena that more people experience than you might think. Depersonalization is characterized by a sense of detachment from oneself. It's like you've become an observer of your own body and thoughts, as if you're watching a movie of You might feel like a robot, or as if you're living in a dream. On the other hand, derealization is a perception of the outside world as being dreamlike, foggy, or somehow unreal. It's as if there's a glass wall or veil between you and the world around you. You may feel detached from your surroundings, or the people and objects in it may seem unfamiliar or strange. Now, these might sound like experiences from a science fiction movie, but they're actually quite common. Many people will experience moments of depersonalization or derealization at some point in their lives, especially during times of intense stress or fatigue. However, when these experiences become persistent, recurrent, or cause significant distress, they can be symptomatic of a serious mental health condition called depersonalization-derealization disorder. This is a type of dissociative disorder that can severely impact a person's daily life and overall well-being. But it's not all doom and gloom. The good news is that understanding these phenomena is the first step towards managing them. Knowledge, after all, is power. And with that power, we can demystify these experiences, making them less intimidating and more manageable. So let's delve deeper into this fascinating topic. We'll explore the symptoms, causes, and treatments of depersonalization and derealization, shedding light on these mysterious experiences. In the next few minutes, we will break down the symptoms, causes, and treatments of these strange phenomena. So stick around, you might just learn something that could change your perspective on life. Let's start by understanding the symptoms. What does it feel like to experience depersonalization or derealization? Depersonalization and derealization can manifest in a variety of ways, but some common threads tie these experiences together. The most overarching symptom of both conditions is a profound sense of disconnection. This disconnection can be from your own body, your emotions, or the world around you. Imagine for a moment that you're observing your own life as if it were a movie. You're there, but it's like you're watching yourself from a distance, detached from your own actions and feelings. That's a common description of depersonalization. It's as if there's a glass wall between you and your own self. Derealization, on the other hand, distorts your perception of the outside world. It might feel as though the world around you is not real, as if it's a dream or a mirage. Objects and people can seem distorted, either too close or too far away. Colors may seem either too bright or too dull. Even time can seem to warp, passing either too slowly or too quickly. Another shared symptom of depersonalization and derealization is emotional numbness. It's not uncommon for people with these conditions to feel a lack of emotion or a difficulty in expressing emotions. This can lead to a sense of being robotic, as if they're going through the motions of life without truly experiencing it. It's important to note that these symptoms can vary greatly from person to person. Some might experience all of them, others only a few. They can come and go, lasting for just moments, or persisting for days, weeks, or even longer. These symptoms can feel incredibly alienating and confusing. They can make people question their own reality, their sanity, and even their existence. However, they are not a sign of madness, but rather a response to certain triggers or conditions, which we'll explore in the next segment. These symptoms can be quite unsettling, but what might cause someone to experience them? Depersonalization and derealization can be triggered by a variety of factors. Let's delve into the main causes of these conditions. A common catalyst for depersonalization and derealization is severe stress. This can stem from work pressure, social issues, or personal dilemmas. When the burden becomes too heavy, the mind may resort to these conditions as a way to detach and cope. Trauma, especially childhood trauma or traumatic events in adulthood, can also lead to these feelings of disconnection. These experiences can be so overwhelming that the mind, in its attempt to protect itself, might create a sense of unreality, making things seem dreamlike or distant. Substance use is another significant factor. Certain drugs such as marijuana or hallucinogens can induce feelings of depersonalization and derealization. An individual might feel detached from their body or feel as though the world around them is unreal. Then there are certain medical conditions that can contribute to these feelings of disconnection. Conditions that affect the brain, such as epilepsy or migraines, can cause episodes of depersonalization or derealization. It's also found in individuals with certain types of dementia. Lastly, mental health disorders, including anxiety and depression, can trigger depersonalization and derealization. These conditions often involve intense feelings of worry, sadness, or fear, which can lead to a sense of detachment or feeling that the world is unreal. It's important to note that while these causes can trigger episodes of depersonalization and derealization, they don't guarantee that someone will experience these conditions. Everyone's brain and experiences are unique, and so is the way they react to these triggers. Understanding the cause can help in managing these conditions. It can aid in identifying triggers, adopting coping mechanisms, and seeking appropriate treatment. It's a stepping stone to recovery, a light in the fog that can guide towards a more grounded reality. Knowing the cause can be a starting point for treatment. But what does treatment look like? Let's explore that in the next segment. Depersonalization and derealization can be disturbing experiences, but there are treatments available. That's right, these unsettling phenomena are not life sentences. They can be managed and, in many cases, significantly reduced or even eliminated. Let's delve into the main treatments. The first line of defense often involves cognitive behavioral therapy, or CBT for short. This is a type of psychotherapy that helps people understand and change thought patterns that lead to harmful behaviors or feelings of distress. In the case of depersonalization and derealization, CBT can help individuals challenge and change unhelpful thoughts and beliefs that may be contributing to these experiences. It's like rebooting your mind's software to tackle glitches that have cropped up. Mindfulness techniques are another key treatment strategy. These techniques can help ground individuals in the present moment, which can be particularly helpful for those experiencing feelings of unreality. Practicing mindfulness can involve a range of activities, from meditation and yoga to simple breathing exercises. The goal is to anchor one's awareness in the here and now, fostering a sense of connection to oneself and one's surroundings. Medications can also play a role in the treatment of depersonalization and derealization. While there is no specific drug for these conditions, certain types of medication such as antidepressants or anti-anxiety medicines can be used to help manage symptoms. It's important to note, however, that medication should always be considered in consultation with a healthcare professional, and it's typically most effective when combined with therapies like CBT or mindfulness techniques. And that brings us to a crucial point. Treatment should always be individualized and guided by a healthcare professional. What works for one person may not work for another, and it's important to find a treatment plan that fits your unique needs and circumstances. Remember, depersonalization and derealization are not indications of losing one's mind, but rather, they are signals that your mind is trying to cope with stress or trauma. So don't lose hope. With the right help, it's entirely possible to manage and even overcome these unsettling experiences. Depersonalization and derealization can be frightening, but understanding them is the first step towards managing them. We've journeyed through the labyrinth of these complex phenomena, uncovering the mysteries that often surround them. Let's take a moment to revisit the key points we've discussed. We began by defining depersonalization and derealization, two conditions that disconnect a person from their own self and reality. These aren't just fancy words. They represent experiences that can be deeply unsettling. Symptoms can range from feeling detached from one's body or thoughts to perceiving the world as dreamlike or distorted. We then delved into the causes. While the exact triggers can vary, they often stem from severe stress, trauma, or the use of certain substances. It's important to remember that these experiences are not a sign of madness, but rather, they are the brain's way of coping with overwhelming situations. Equally important is the knowledge that these conditions are treatable. We discussed various approaches, including cognitive behavioral therapy, which can help individuals understand and change thought patterns, leading to depersonalization and derealization. Mindfulness techniques can also be effective, as they teach us to reconnect with the physical world and our bodies. And in some cases, medication may be an appropriate part of a comprehensive treatment plan. It's crucial to note that anyone experiencing symptoms of depersonalization or derealization should seek professional help. These are not conditions to be faced alone or ignored. Mental health professionals are equipped to guide you through the process of understanding and managing these experiences. Remember, depersonalization and derealization are not life sentences. With understanding, support, and appropriate treatment, individuals can navigate these waters and reclaim their connection to reality and themselves. Seek professional help if you or someone you know is experiencing these symptoms. Remember, there's no shame in reaching out for support when you need it.